Hi, my name is Arshil, and yeah, I help medical coders. You know how I'll be sharing few practice questions them to solve. This one's the ICD question set that right now you're going to practice. Here is your question. A 56-year-old female was admitted with a large pelvic mass in the lower right quadrant. Pathology confirmed carcinoma of right ovary with metastasis to the omentum or total radical abdominal hysterectomy, total omenectomy, and bilateral salpingo-oophorectomy were performed. What codes would you be quoted? Right, there you go. You have four options. You have around 3 to 4 minutes to answer these questions. If you're someone who is looking for more content on medical coding, you might be someone who's just preparing for a certification or someone who is a medical coding professional. Why not subscribe to this channel, because I'll be putting out a lot of content on medical coding. And leave a like and let me know in the comments what do you feel about the content. If you're looking for something in particular, I might just make a content out of it. All right, there you go. This is your question. All right. Answer to this question is option D, that is C561, C786. And you're going to quote two cancers carcinomas over here, and also one is primary and the other one is secondary. Moving on to next question. 27-year-old male with AIDS and Kaposi's sarcoma of the skin was admitted for a closed fracture of 4 ribs. A pressure dressing was applied and he was referred to an infectious disease specialist. What codes would be reported here? There you go. Another 3 to 4 minutes you have got to answer the question. All right, the answer to this question is option B as 2249XA, since it was initial B20 as the patient has AIDS AIDS, and C460 as sarcoma of the skin. There you go. Moving on to the next question. Question number 4. What diagnosis codes should be reported for spastic cerebral palsy due to meningitis? Option C is the right answer for this question, G801 and G03.9. Moving on to next question. What diagnosis code should be reported for a patient with polyneuropathy due to sarcoidosis? Let's go. Right. Option C is the right answer here. That is D86 9 and G63. Moving on to next question. 32-year-old sees doctor about a lump in a right breast. Her mother and aunt both have history of breast cancer. What diagnosis code should be reported? There you go. This is your next question. All right. Answer to this question is option D. That is N6310 and Z803 as for history of breast cancer. Family history, since a mother and aunt is mentioned. Moving on to next question. A 50-year-old female visits her physician with symptoms of insomnia and upset stomach. The physician suspects she is premenopausal and diagnoses impending menopause. What diagnosis code should be reported? Yeah, don't forget to like and subscribe to this channel, man. I see you're not not liking to this one. Also mention in the comment if you I mean if there's any feedback for me. All right, to answer this question, option D, Z780 is the right answer as it's impending menopause. All right, moving on to next question. Z780. Let me check. Let me check. Impending menopause, state of menopause. Yeah, I mean, can be led to this code. Moving on to next one. What does MRSA stand for? Should take around a minute to answer this one. All right, be quick on this one, please. All right, the right answer for this one is obviously methicillin resistant that has been mentioned in both the options. But then Staphylococcus aureus is the right answer. So option A, did I mention the same? Yeah, option A is the right answer for this one, MRSA. Moving on to next question, second last question for this video. When the type of DM is not documented in the medical note, what is the used what is used as the default type? Should be a way easy one. If you're not able to find the answer is mentioned in your ICD guidelines as well. All right. Answer to this question is type 2, that is option A. Moving on to the last question. The last question is, did you like this video and have you subscribed to this channel? All right. A patient with viral hepatitis A is being treated with glomerulonephritis caused as a manifestation of his hepatitis. What ICD-10 code should be reported? All right. If you have not got the answer, please pause the video because I'm going to tell you the answer. The answer to this question is option D, that is B159 and N08 for nephritis. There you go. Uh, all right. If there's any feedback for me, please let me know in the comments, and I'll see you in the next one. I'm Harshal, and this is Decode Healthcare with Harshal. Thanks for watching.